Mike, David, I think you're now live on the agenda. People can join straight into your room, and it looks like we have a few folks already joining.
Awesome. Thank you so much, Holly.
Yeah.
So welcome to everyone who's joining the session now. We'll wait a couple of minutes until more people join before we start. So please get comfortable, grab your coffee, and we'll start in just a few minutes. For those of you who are joining just now, welcome to this session. We'll start in just a couple of more minutes until more people join. But in the meantime, please go to the website slido.com and enter the code or use the QR code. So because we'll start with a quick poll just to get to know you a bit more. So please do go to the website, and we'll start in just a few minutes. In 2 minutes tops. All right, I think that we can start. I'm gonna share my screen again. just so you can see this. So we have 15 participants now. Good morning, good afternoon, good evening, good very early morning for some of us. Welcome to this Young Professionals networking session. My name is David Imbago. I am Core Group's Technical Programs Officer joining from Ecuador. And I will just be opening this session and introducing you to the amazing moderators of this panel. Just to mention quickly that this session is hosted by the Young Professionals Network of Core Group, which is the official network of people between the age of 21 to 35 years old of Core Group. That includes students, interns, and young professionals who are working in the field of community health, global health, and development in general. So I will now hand it over to Megan Picarillo and Chelsea Kohlberg, who are the Young Professional Network coaches of Core Group. So over to you, and we'll start with a quick poll. So just let me know when you're ready to start the poll.
Thanks so much, David. Good morning, good afternoon, good evening to everyone. We're excited to have a group here this morning to connect and just to get to know each other a little bit and talk about the conference to date so far and just any questions you all want to talk about. And so, we can get started. I think if the poll is live, we can go ahead and answer the first question, which is where are you joining from? These are just some questions to get to know who's in our little networking session this morning. You might need to press refresh in order to see the poll.
Then Megan and David, just FYI that I went ahead and dropped the link to the poll into the chat box. I noticed there was actually a period in the middle of the Slido link and was able to enter the code successfully.
Thank you.
Okay, it looks like we have a number of people joining from Europe, which I think makes good sense given the time of day it is for most of us in the Western Hemisphere. Maybe we can move on to the next polling question. Okay, so now we're just curious to know more about our educational backgrounds in the room. So go ahead and enter your highest level of education. Okay, and I think our last poll also had about 8 respondents. So it looks like this is our response. Oh, we have someone else adding, perfect. Lots of grad students or graduate degrees in the room. I myself only have a bachelor's at this point, but we'll get ready to start grad school in the fall. So maybe we can go to the last polling question, David. Perfect. And it looks like for this question, you can select more than one answer. So go ahead and select everything that applies to you. Looks like lots of maternal and child health practitioners, which makes good sense given that this is the Align MNH conference. And for those who entered other, maybe you can go ahead in the Zoom chat and just input what those other interests or experience backgrounds might be. Great. Thanks so much, David, for creating those polls, and so we can get to know each other a little bit more. Chelsea, can I hand it over to you?
Yes, I was just filling in my other in the chat. Hello, everyone. I'm Chelsea Kohlberg. I'm the other co-chair. Well, there's three of us actually. The other one is sleeping because she's even further west. But yeah, I'm happy to lead the next question. Okay.
Yeah, and people actually can use also the Q&A function from Slido. And it seems like we have a question from someone who has who says, how do we network properly as public health professionals?
Oh gosh, that word properly. I don't know that there is a proper way. Maybe some common ways. I think also the point of this session is to be very casual and informal and connect with other people. So if anyone else in the chat has responses to this, please feel free to add your responses. I guess I could start. I don't know that there is a proper way. There are several professional networks you can join, including Core Group and Young Professional Network, as I just sort of plug my own network here. And you can definitely connect with people on LinkedIn. So even after this, feel free to find me on LinkedIn, find Megan on LinkedIn, David, all of us here on LinkedIn, and give us a message. And don't forget about us in 6 months or a year when you're like, I have nobody in my network anymore. Yes, you do. You connected with us already. Just reach back out. So if anybody else has other suggestions or possible places, even feel free to write them down in the chat so this person can write them down themselves. That would be great and helpful to everyone. I think this is a great question for everyone.
Yeah, and just to add, I think networking right now virtually can be additionally challenging because there's something about face-to-face interaction that I feel like is really beneficial, especially to build relationships. With that being said, we're grateful that you all joined the session this morning. Again, this can be super informal, so please feel free to come off mute and share your experiences, how you like to network, what your preferred networking opportunities or pathways are. I also would like to add that for the Young Professionals Network, which you can sign up on Core Group's website for the listserv, I believe, that we will be hosting a bunch of different sessions in the coming year. Next week, we actually have one about giving effective presentations, giving effective virtual, so online presentations, which given that we're all virtual or mostly virtual right now, it's a very timely session. We'll also be doing some fun, more social networking, including trivia night in May. And then in June, we'll also be looking at some critical questions around environment and health. So we'd love to have you at those events. And if you join the listserv emailing list, then you'll get the notifications about those as we plan them.
Yeah, I can also just jump quickly, Megan and Chelsea, in this question about how to network properly as public health professionals. And building on what Chelsea was saying about LinkedIn, for example, I think that is also important to keep your profiles updated, for example, and also to know what you're including in each platform. So for example, if you think that your professional networks are LinkedIn and Twitter, make sure that this also aligns with what you want to project as a professional. So that means, for example, sharing content that is related to your area of work, content that is also related to professional content, let's say that. So you're not going to be sharing their music videos, or you're not going to be sharing like inspirational quotes, these kind of things. I think that you also need to know what goes where. So for example, if you want to, I don't know, post something funny, then go to your Facebook and keep it as something personal and private, and make sure that your settings are also set up in that way that that only your friends will see those kind of things. And if you want to make sure that Twitter is your like place where you do some advocacy, or where you do where you share some, I don't know, news or those kind of things, make sure that is consistent across platforms. So you're also projecting this image of being organized and also professional in general. And I see that there's another question. How do you seek out mentors in the global health space?
Core Group does have a mentorship program to match more early professionals with more seasoned professionals. It happens every year and it's a match program. So it's all based on who applies on both ends. That is one avenue I'm aware of. I know personally, I found a couple mentors through just seeking out webinars and then contacting people that I felt either stood out to me in the chat, like maybe they were just an attendee or they were actually presenting. And I did some search terms on LinkedIn and just started looking for people in my field. I'm the first person to do what I do at my job. And I'm a recent graduate. I got my graduate degree in 2019. So I was struggling and I was like searching everywhere for anyone who could talk to me about how to do my job. And I did find someone on LinkedIn, and I did find someone through just attending webinars and reaching out directly. And it does take some risk. And I think getting out of your comfort zone to try and reach out to people, especially as a stranger, especially virtually. So I totally agree with what David said. Keep your LinkedIn updated, keep everything updated so that they can get a feel, not just for what you do, because LinkedIn is more than just your resume. You have the availability to repost or even write your own blog articles on LinkedIn, which I've done. So people can actually read about who is this person, what is their personality, what are their values, what are they about? And I really like that about LinkedIn. So be uncomfortable, reach out to strangers, and give people a chance to see who you are on these platforms.
I just posted on the chat the link to mentoring her. I hadn't heard of that either. I don't know if Kate, at any point you want to come in and just give us some brief explanation, that would be great. If not, I think that we can go to the website and take a look.
Hi, yeah, mentoring her was really cool. I met someone from the Bill and Melinda Gates Foundation and had a really nice talk with her on that website. And it's just, I mean, as it sounds, it's just for like female mentors with female mentees, but it's also totally free. And yeah, it's really neat. There's not a very big amount of people who are actually like on it and using it, like in the global health field from my experience, but I would still recommend 10 out of 10.
They'll be there if we get there, you know, if you build it.
So it looks like another question that came in was, what are you supposed to ask recruiters in virtual career fairs? Great question. I think some of this will apply to regular career fairs as well, and might also apply to interviews. And the first question when I read this that came to my mind would be, what are you looking for this position? So what kind of background are you looking for? What kind of person are you looking for? What are the qualities that you're looking for in this for someone to fill this position? I think virtual career fairs can look very different depending kind of if they're more related to the nonprofit sector or government sector. So it's a little bit hard, but to answer this question, but that's the first that came to my mind. And please, anyone who has ideas, do chime in.
Yeah, I would love to hear from some of these other people on the call. You can't just ask questions. You also must contribute. It's a networking session. Megan and I are not special. We're just here, just like you. So we'd love to hear from you. This is a great question. What do you ask recruiters in virtual career fairs? Also regular career fairs. I know I went to UNC, University of North Carolina in Chapel Hill, and our professional development person, it was incredible. And she shared a lot of resources with me on CV writing, interviewing skills. And I have all these in like a Google Doc. So if anybody would like access to these documents, please force yourself to reach out to me after this on LinkedIn, and I will email you all these tips. And some of the things that she talked about specifically here was go in with your elevator speech, who you are, like one sentence of either your background experience or like I'm in school or I did this program, now I'm looking for exactly what Megan said. What are you looking for? Because you want to be real quick when you talk to somebody. If it's a recruiter, they're busy people, they're talking to 1,000 people that day. So have your elevator speech ready to go. Practice it in front of the mirror, not just what you say, but how you say it. Are you dynamic? Are you smiling? Are you making eye contact or camera contact in this case? Make sure your background looks professional or clean, or at least expresses some of your personality in some way to make you memorable. You know, no one's ever going to forget that Chelsea has a harp in the background of her video. That's very memorable. And I somewhat do that on purpose. So, you know, keep little things like this in mind. But I would love to hear from other people. Again, we are not special. We're just like you. On video, show us your videos and please speak.
Yeah, I'm gonna read just the answer from Francesca. Says, I would love to contribute, but I have been struggling with reaching out and networking during the pandemic. I have been ghosted a couple of times and it was not easy. This just means I have to keep up putting myself out there, but it's hard. Yes, and just on this note, I think that also something that we don't discuss enough in terms of young professional network is that mental health is very, very important. And please do take care of yourself first. I know that being virtual now, everything is more complicated and it's not as encouraging as it is as in in-person meetings, for example. I mean, right now, I think that we would love to be in person, just having these discussions, but do consider taking care of yourself first and knowing that what are your limits, how do you feel comfortable right now networking? If it's only over email, it's only over email. If you want to have calls, but know your limits and know what you are willing to do right now and what you're capable, and also what is good for you. I think at this point, because I mean, we're here for a while, because it seems like COVID is not going anywhere anytime soon. So yeah, they have to just, this is not a race, it's more like a marathon. So yeah, that's just my 2 cents on this.
Yeah, I was just going to add, David, that I think this is totally a challenging situation. It can be sort of demoralizing or discouraging. And so I think it's important to keep perspective that it's likely that the person we're reaching out to is busy and might not be responsive in terms of they're just overwhelmed. And it's not you as a young professional per se, but it can be hard at entry level to get, I guess, people's attention and the respect that all young professionals and all professionals in general deserve. The other thing I wanted to say, though, and Chelsea, I think this tip came from you, but maybe I'm mixing up people in my life. But I think you once said that when you're reaching out to someone, what you can say in an email is, I understand if you're unable to help me right now, or you're unable to connect, but can you connect me with someone else? So kind of framing it as, I'm reaching out to you because I think maybe we have something in common or we have a common interest. If you're unable to connect right now, is there someone else who you can connect me with? And that kind of opens the door for more connections to be made rather than the door simply being shut. Winifred, I see a hand and I'd love to pass it to you.
Yeah, I just wanted to make a comment about them looking for research opportunities. So from my personal experience, it's always good to just look around, especially the faculties in the school that you studied in. Many times there are opportunities available, but then they are not really advertised. So if you just put yourself out and talk to a professor and say, oh, if you are doing any research, and a lot of times the papers they are writing and research they are doing, they really need extra pair of hands, but they can't really recruit. So you can just offer a few hours to maybe do some literature research or do some part of the analysis. And the good thing is that you might end up having your name on some of those publications. And also when a formal opportunity opens up to recruit somebody, it's easy for you to get in your foot in the door and get such opportunities. And if you're interested in maybe studying for a PhD or a master's degree or a research-related degree, it's also a very great thing to have such experience on your CV. And these people can be really good mentors and referees to for future opportunities. Yeah, so just looking around your immediate surroundings and schools is a good first step to take.
Yeah, that's fantastic. I think similarly, you can, if you see a research article that's really interesting to you, you can then reach out to the authors and see if that can strike a conversation. But Winfred, you highlighted a lot of really great points. I saw a question that we sort of skipped, which is tips on CV writing. So I actually get really passionate about this, as Chelsea was able to witness yesterday. I think one thing that is so important with CV writing is formatting, because as soon as someone opens a CV or a resume, is more commonly used here in the US at least, and it looks really disorganized or a bit chaotic, I think that can really turn people off quite quickly. So we want to look at fonts that are easy to read and consistent throughout. Typically, if you're just out of undergraduate or don't have a lot of relevant experience, you want to put your education up top. But if you have a lot of good relevant experience, you can put that up top and start with your experience and then put your education towards the bottom. I think David said something in the chat that is so fantastic, which is a shorter resume a lot of the time is best because it shows that you can be succinct. Obviously, if you have 25 years of experience down the line, then you're likely going to have a longer resume or CV. But so I think the top line recommendations are short and sweet, concise, good formatting, reverse chronology. That's correct. So most likely you're wanting the most recent experience at the top, and then highlighting something that I was always told is looking at a job description and then using the keywords from that job description in your resume as well. So if it's saying looking for management experience, wanting to make sure you demonstrate how your experience to date links to that management experience, and maybe even using the word manage in your resume, because those will be words that people are looking for. Anyone want to add?
I also learned at a professional event that a lot of resumes don't even get seen by people. If you're looking through big organizations, they just get filtered through programs. So if you are not using key search terms in your resume, you won't even make it past the computer filter. So make sure you really read the job description and put those specific words in there, because that is what they're using to find you. I'm also going to put in a link to my Google folder about interviewing. I know it's a one-off, but it's related. Once your CV passes and you get the interview, it's common questions you might receive, how to answer those questions, especially behavior-based questions, interviewing techniques, questions you should ask your employee, and a couple other things. But yes, others, chime in.
Yeah, I'm seeing just the answer from Winfred about give it to someone to review. I think it's something very simple, but it's very useful, because I mean, of course, they can just check, spellings, grammar, just a general thing, but also they can give you input, like say, hey, I think that you should be featuring this thing more, or yeah, maybe you should not include this, or those are my recommendations. I think that also I have been having reviewing some CVs for some positions lately, and my biggest advice is please keep it as short as possible. I have seen some CVs that are 9 pages long. For example, I think that attending conferences that you have attended is not always relevant. So I would, for example, I would not include that. And maybe you have a long list of publications, you can set it as an annex, for example. That's something that you can do. Or also what I have seen that I think that is also a good practice is you can also create your own site on Google that will be like your website. and you can add as many information as you can there. So you can have the full list of conferences that you have attended, the full list of publications that you have, more information about each of your work experiences, and so on. So people can click there if they want to see more, because if they have seen already like your CV and they are interested, that means that they will go into the website to see more. So yeah.
Does anybody have a question they'd like to unmute and ask? I think I'm sort of thinking personally, I would love to connect with other people in my field. And even though I'm a co-chair of the YPN, I'm still looking for other young professionals like me and thinking of how to build those relationships. Yes, professionally. What does professional mean? I think, everyone's kind of definition of that's a little different, but if anybody has ideas on more technical grouping or something like that, maybe connecting with other people on a technical level outside of core group, because I'm aware of those, that would be great to know too.
If anyone wants to also join us unmuting themselves and just asking questions or comments, please do so. We're more than welcome. We're far from being experts, but we will welcome your inputs, of course.
Francesca, would you like to add something? I see you're coming off mute. Please go ahead.
Yeah, sure. I guess I would, I don't know, so for me, it's weird because I feel like I'm kind of new to the global health world. I mean, I am a clinician, so it's not that I come from a completely different area, but so I've been training for a very long time as a medical doctor, and then as an obstetrician gynecologist, and I'm kind of transitioning right now and trying to pivot my career more towards research, and specifically research in global health. So I feel like I am at an age that is probably different from yours, so I'm a little older in that sense, but I'm still looking for like young professional opportunities and trying to connect with people that are at the beginning of this career. So I would love if we could somehow put together a technical group. I also would be interested in maternal health. As an obstetrician gynecologist, that is what I'm passionate about. So yeah, for sure. And I would also like to know what you guys are up to, what you're doing, where you are right now. I don't know if you already said this at the beginning of the session, but I think it might be useful.
Yeah, I'd love for people to unmute and just say it if you can, just to feel like there's actually people in the room. I can say I am a registered dietitian by training. I was a teacher before doing this. So I'm also sort of a career changeover. And I'm a nutrition technical advisor now for international nutrition security programs. So I work with Rise Against Hunger in North Carolina in the US. And we have sort of two avenues. We have meal delivery, where we package meals and send them, which is not my heart and soul. I'm more on the sustainable program side, where we are empowering locals, specifically women and smallholder farmers, to provide their own food so that we reduce dependency. And I'm really interested in decolonizing aid, specifically food aid, but all types. And this idea of racial justice as it connects with food and this whole industry. So maternal health, definitely on board with that. That's just something that I'm doing. And we have some programs in Malawi and South Sudan are the two that I'm like developing, but we have some other programs kind of everywhere all over the world. We send food to over 30 countries. So that's kind of a bit about me, but please unmute people, not unmute your video. What is it called? Just show your video, turn your video on. Let us see who you are.
Okay, I'm Jacinta. I reside here in Netherlands. I'm a master's degree student of KIDS, Royal Tropical Institute, Netherlands. I'm studying Masters in Public Health and International Course in Health Development. But back in Africa, I am a graduate nurse. I work with Planned Parenthood. So I specialize in SRH, and I have over 5 years working experience. So I'm a service provider, and I'm also a fan of adolescent sexual and reproductive health. So I think that's my background for now.
Hello, Ankur. I live in India and primarily in quality of care around maternal. I've been consulting in South Asian countries, primarily Bangladesh and India, Nepal, Bhutan. So there's a lot of, as you would know, South Asia has a large chunk of maternal and newborn mortality, and quality of care is an issue. So there's a lot of need for, helping healthcare providers understand what quality improvement is and be able to do it. So that's my sphere of work. And I have some advice for those looking for research opportunities. Many times we keep looking at the general portals where, like the UN portals or DevNet jobs, or I don't know what other portals you look for. Many specific research opportunities do not get listed out on these generic portals. They are usually put up as a random call for interested researchers on the page of that particular research group. For example, there is this HRP or Human Reproduction Group, which is USAID, WHO, World Bank, many other groups, they together work on sexual and reproductive health, particularly with human reproduction. So recently they had a call for researchers, and it was a call for a roster. So I'm presuming they have multiple positions. So that never got posted on the WHO careers portal or the UN career portals, but it was posted on the page of that very group. So once I saw that, and after that, I've been looking at those specific groups who do the work that I'm keen on, and I've been successful many times. At least locating those and applying for them. So that's a small tip that I have. Thank you.
Hello, it's Winfred once again. Yeah, so just a quick intro. So I work in public health. I worked with Ghana Health Service for several years as a health information officer, and some international organizations in monitoring and evaluation. So basically, I'm more of a data guy, looking at lots of data, how to measure indicators, look at coverage and stuff like that. I have over a decade experience working in public health in Ghana. So I've been involved in almost everything, looking at every type of data, maternal health, immunization, HIV, tuberculosis, almost everything, like a jack of all trades. Yeah, that's what happens when you look at data. Everyone throws any type of data to you. So later in my career, I took a quite what people consider unconventional. So I decided to learn geography, but which is interestingly very important for public health. So I went to learn a master's in GIS and remote sensing at the University of Southampton, UK, where I currently reside. So I then moved on to a PhD. So a lot of my maternal health research looks at spatial distribution of services, how pregnant women interact with maternal health services, access and use of services, measuring among emergency obstetric care indicators, measuring travel time to services. So basically, I just apply spatial technology. So I do spatial epidemiology and apply those to public health and specifically maternal health. So my PhD looks at how pregnant women access healthcare services in Ghana. Yeah, and I'm also involved in the Countdown project that Tis mentioned yesterday in the opening forum. So I'm one of the collaborators at University of Southampton, collaborating with Ghana Health Service and the University of Ghana, implementing projects on how to use routine health data in measuring progress towards the SDGs. Yeah, thank you.
Thanks, Winfred, for sharing. I guess I can go ahead and share a little bit about my background. I come from a background in international studies and public health. So my goal has always been to work in global health. And so far to date, I've been really focused on maternal and child health, but also was previously working on HIV/AIDS programs at PEPFAR at the US State Department. Now I'm at USAID in the Office of Maternal and Child Health and Nutrition, actually currently working on our Gavi portfolio, including COVAX. So a very timely and busy season for us. I'll be going to Columbia University in the fall for my master's in public health and plan to focus on adolescent health specifically. But interested, I think adolescent health typically is really focused on in terms of sexual reproductive health, but I'm actually interested in kind of the broad array, including mental health and lifestyle. So nutrition, fitness, etc. I think there's sort of an expectation that to work in global health, you have to work at, some high level organization like WHO or something like that. And I actually think that community health is global health. So I'm also looking to, beyond kind of my my career focus and educational background, looking to become more engaged in my community as a doula to support pregnant people during that life transition. And I'm really interested in that peer-to-peer social support that I know Kate, who had to jump off, also mentioned. So it's a little bit about my background.
I can share also about myself. So I am working at Core Group right now. I am a technical programs officer. I am from Ecuador. I'm based in Ecuador. My background on education, I am a medical doctor, and I am also a master's in public health student. I am about to finish my MPH. Hopefully in the next month. I am studying at the Pompeu Fabra University in Barcelona. And we don't have a focus in the general MPH, but I have been focusing on global health and also on health and economics, which is very random for a medical doctor, I think, but it is what it is. I'm also, besides my work at Core Group, which I started last year in April, it's been a year already. I'm also the chair of the Adolescents and Youth Constituency of PMNCH, which is the Partnership for Maternal, Newborn, and Child Health. I'm also, I have been in PMNCH for about 4 years now. I started as a board alternate, then I became a board member. And I'm also doing some research around climate change, for example, and also mental health. So my master's thesis is actually about the evaluation of the prevalence of depression in the Spanish population after the COVID-19 pandemic hit. So yeah, feel free to connect over any topic related to SRHR, maternal health, mental health, climate change, adolescent health, of course. So yeah. Anyone else who wants to share about their background or anything? There's a question. Any tips on how to list consulting experience on LinkedIn profile? There's a small assignments that I do with multiple agencies that make a long list in my CV. I add or skip some based on what is important for the assignment and have a separate section on consulting assignments. That's a very good question. I think that for LinkedIn, you can just add like consultants or freelancer as a job, and you can list it there as a description. For example, the most relevant. I mean, if it's something that was very small, then probably it's not worth it sharing, but the most relevant or the biggest ones, you can definitely put consulted for this organization and did this and keep it short. Yeah. Just my idea.
Thanks, David.
Ankur, I think it's great to, on a CV specifically, to separate those shorter assignments out with consulting, a title of consulting experiences, and then I guess the position title that you held, if it was specific to maternal child health or newborns or something like that, the organization, the dates. I don't necessarily think, unless it's really relevant to the position you're applying for, that you need like a full bullet, like bullets explaining what the consulting was on, like you would for a full-time position. But that being said, if it is really relevant to a job you're applying to, I think it makes sense to pull it into your general experience section.
All right, thank you. Thank you, Megan.
Remembering that CVs and resumes don't always have to look the same, and that we can really customize them to each position. It makes a lot more work for us, but I think it can pay off a lot.
Right.
Would anyone else like to jump in, share their background, and or pose questions for the group?
Well, I just jumped on. I'm happy to introduce myself. My name is Bina Kameth-Rain. I'm a neonatologist. I have been working at the American Academy of Pediatrics for the last 18 months. My official title there is Vice President of Global Newborn and Child Health. So I oversee all of our clinical skills training programs, as well as our neonatal global health portfolio. So many of you are probably familiar with the Helping Babies Survive programs. And so we sort of run the programs on behalf of all the partner organizations out of the AAP. It's nice to meet everybody, and childcare issues kept me from joining sooner, but it's nice to be here.
Thank you for sharing. And it sounds like your childcare issues are on brand for what you do. So that's always fun. Yeah, we only have about 10 more minutes. I'd love for people to just say whatever they want now.
So guys, I jumped into public health career after about half a decade of experience in clinical care. And sometimes I wonder, should I keep the clinical experience on my CV or should I not? How do you go about it?
Well, I can say that when I started working at the AAP, I gave up clinical work for a short period of time. And I really missed being at the bedside because I felt like it was the inner fire for the work that we do. And so I actually carved out some time for myself to continue to do clinical work. And I do keep it on my CV. I personally feel like it adds that the person knows what they're talking about because they're in the trenches and they understand what it's like.
Yeah, I keep it too. I mean, I haven't seen a patient in over a year, but I also keep it there because I think that also gives you an added value, let's say that, because you also have like that technical background, which is the medical background or whatever background you have. And also it improves also your CV and your qualifications, I think.
Right. That's helpful. Thank you.
I was curious if anyone has faced any issues with trying to kind of move beyond having a mentor. I think we all will always need mentorship in our lives, but mentors that really got us to a certain level, at some point we have to like let go and, you know, fly ourselves, and how you make that transition in a way that is true to you, but also appreciative of what your mentor has done, but not continuing to let them kind of keep you under their wing.
I'm still under the wing of my mentor, so I don't know. I guess, is the capacity of your mentor in a professional setting? Is this someone that you sort of just personally communicate with? I would imagine it's kind of like when you grow apart from a person in your life, you could just kind of lessen the communication. But I guess I'm not sure if it's like a day-to-day, you must check in with them every day. Yeah, okay, then yeah. I mean, at your discretion, I guess. I personally would feel like if the shoe were reversed, or, you know, if you were the mentor, kind of, hopefully you're mentoring someone out of a space where you want them to grow. You know, you want them to see beyond just the advice you give them and start thinking for themselves. And you were a practitioner, so I'm sure you loved when the light bulb went off for your patients. It's kind of a similar idea. So maybe just applying that mindset, but I'm still very much under wings. So anyone else can contribute.
Yeah, for me, I think if it comes to maybe professional practice, I would just liken it to maybe doing research at the point where you start demonstrating to your mentors that you are capable of leading staff. So maybe coming up with novel ideas that you can lead the research on, be a lead author on such a research, go to them for advice throughout the way they review the work for you, but you are in the driving seat taking major initiatives. Those are the instances where you demonstrate that you are about to become, or you are becoming more of an independent researcher. If it is day-to-day public health practice, being able to draw your own micro plans very well, implementing activities, and occasionally just going to your mentor for them to validate what you have done, and not necessarily have to sit down for them to give you all the ideas or tips on how to plan your work. Then you started somehow demonstrating that you can be an independent practitioner. And at that point in time, they also realize the need to somehow let go of you, not to have too much of an influence on what you are doing, but rather to more of synergize your activities and put that icing on the cake, because they would then realize that, oh, you are doing so well. I don't have to spend too much time giving instructions or coaching or mentoring, but I can just occasionally come in and see that things are going well. Yeah, personally, I think that's what works for me.
Something I just wanted to add is also the importance, though, of maintaining mentorship roles. It can be a hard balance, because it sounds like, Bina, for you, it might be feeling like a little bit consuming, but also there's like the other end of the spectrum where you only reach out to mentors when you're looking for a recommendation. And I think that can turn people off as well. So it's really finding like a fine balance of maybe providing like life updates or career updates like quarterly or once or twice a year, but kind of over time, yeah, decreasing that communication, but maintaining a relationship so that it's not, you know, every 2 or 3 years reaching out for a recommendation for a new job, in which case people start to feel like kind of like just used for career advancement. But maintaining a relationship is important. But I think it sounds like boundaries are needed in this case. With just a few minutes left, I'm seeing 4 minutes left on my clock. Does anyone want to add a quick question or comments, or maybe some resources? We leave it all to you. Please do join in.
Yeah, and for those who joined later and didn't see the link to join the Young Professional Network of Core Group, I just posted a link on the chat again. So please do connect there. I know that Megan and Chelsea have great ideas for this year, for events. And considering that the topic of this event is maternal newborn child health, I'm also posting the link of the Core Group listservs, so you can also subscribe to the Reproductive Maternal Newborn Child Adolescent Health listserv if you're interested in that. Yeah. And yeah, Holly is mentioning that we have to go back to the plenary now.
Yeah, thanks so much, everyone from YPN and everyone for joining. The opening plenary session will begin in just a few minutes. If you navigate to where it says welcome and day 2 opening plenary on the agenda, you should be able to click in and join the live broadcast here in just a minute. Thanks so much.
Thank you.
Bye, guys.
Thank you. Yeah,
Thank
bye-bye.
you.
Bye.
Everyone, have a great day.
Thank you.